Welcome. In this video, I'm going to be looking at a question that I often get asked is, what do psychiatrists do? And I often answer it using a diagram. And it goes like this. When someone comes to see a psychiatrist, they typically have significant problems. And the problems are variously problems of worry. That's probably the most common thing I see. Closely connected with their worries are often they have problems of anger, of disappointment. This also is a really significant poison in people's lives, and the combination of worry and anger can often lead people to be in a cycle of avoidance and often of feeling lonely. These two often result in sadness. And the combination of all leads to problems with relationships. Now, there are other problems like psychosis, problems like bipolar disorder, problems like ADHD. And so, what does a psychiatrist do is that they make an assessment of the problems in a person's life. And typically, people have come to see a psychiatrist because they are overwhelmed by the problems in their life. They've got a life, but their problems are overwhelming it. This is not fun. They're stressed, they're disabled in some way. And so there's two options when you have overwhelming problems. The first response, the usual response, what people typically expect, is that you will solve the problems. You will seek to work with them to work out what the problems are, how they can be reduced or removed. And if that's possible, brilliant. This is bearable. No longer are these problems overwhelming their life. This is the typical medical model. You go to a GP, to a specialist, you tell them what your problems are, they solve the problems with you, and life goes on. And so this, of course, is what psychiatrists do. There are broadly three ways to solve mental health problems. There are the physical ways. So this would be all the things that your mother told you. Routine. Brains love routine. Sleep routine. What you eat, diet routine. Exercise routine. 60 minutes a day is the recommendation. Social routine. In fact, one of the powerful interventions psychologists use is pleasant event scheduling. Schedule in social activities. Schedule in the things that you have to do. There's also things like vitamin D. There's things like you could add to here yoga. Again, a physical way of creating change. Drugs, alcohol, careful, anything that can affect the brain. And so these are ways of working on the brain that can decrease. Because when you're tired, you are more angry. you are more worried. If you're not getting out enough, then your world seems very small. So medication obviously is an option too. Typically, a psychiatrist won't look at medication first. You'll always try these other two before you would go and use medication. But medication is definitely an option, which we may talk about later. The second thing you can do is you can work at the level of the mind. So the mind is what the brain does. So the brain is the physical organ, and the mind is what the brain does, the thinking, the contemplating, the curiosity. And so from a mind perspective, there is the most important thing that a psychiatrist does with a patient is you get agreement on what the problem is. Obviously, for two minds to come together to try to solve problems, you need to agree upon what the problems are and what the treatment structure is. And so a good assessment, not only what the problems are, but are we in agreement, is vital. And support, the kind of things that you get from anybody. A sense that you're important, unconditional positive regard, it's been called. This is a very important part of change. Of course, there are specific psychological treatments, and the ones often used are cognitive behavioural therapy, acceptance and commitment therapy, dialectical behaviour therapy. These are three of the common psychological treatments being used. Mindfulness is a very big intervention at the moment. And I've seen a lot of people have a lot of success with a mindfulness approach. There's also a kind of meaning or a purpose-based therapy. This often goes along with acceptance and commitment therapy. What do I value? Rather than focusing on the problems, focusing on what do I value and how do I get those values met. So this is the second big intervention to deal with overwhelming problems. And then there's working on the world that you live in, or the world that your child lives in. Being a child and adolescent psychiatrist, the patients I see have still got some dependence on their parents or on their carers. And so in that context, working with the carer is working on the child because there is that dependence. So I would almost always work with parents and do parent work, which is the basics of what does a child need to get a united understanding and approach with a parent. What does a child need from you as a parent? Typically with me that's 6 or 7, maybe 8 sessions to get that united understanding and approach, to work out the strategies and how do you do the strategies. Pretty much the book The Good Enough Parent is about parent work. It's the old-fashioned term was child guidance. The next type of work is parent therapy. For some parents, it's enough to get new information, some new strategies, and we'll run with that. Some parents find that even though they know what they need to do to meet the needs of their child, they find they can't do it. So parent therapy is the stage on from parent work, which is what is it about me that makes it difficult for me to parent my child? We all have past histories. We all have past experiences. This isn't that common, but there are some people who wish to understand themselves and how they can help parent their child better and look at their own experiences. Then, of course, the parent's own work. As part of the assessment of a child, of course you would look at the parent themselves. Perhaps they have their own mental health issues, their own issues around worry, anger, sadness. Sometimes the work isn't with the child, sometimes the work is with the parent. What is it about me, my drug and alcohol use, my relationship styles, my worries, my anger, my sadness? And so that is another intervention that's done. Typically, in my own practice, parent work would be done and then we would move into family work. And family work is where we come together, the parents are in agreement, have a united understanding and approach. Now we're going to bring the kids in. What kind of family do we want? How are we going to get it? And the work is mainly done by the parents with the children at home, and then maybe weekly, but more typically 4 weekly, we would get together and we would look at, as a whole family, trying to do it in a very playful way. What is it about us and how can we change it? And how can we have more fun? So this is the typical approach, what people would often expect of a psychiatrist. But what do you do about problems that are unsolvable? Not all problems are solvable. Sometimes problems won't go away. Sometimes problems can be wicked. As obvious examples, the past is always wicked, in that it's unsolvable. If we define wicked problems as unsolvable problems, well, you can never solve the past. And there's some things about reality that are unchangeable. Your body is your body. Your face is your face. Your parents are your parents. Your siblings are your siblings. There are wicked problems of existence, that every relationship that's important to you will come to an end. The not very happy reality that we all die. These are not changeable realities. The other existential realities, that we're all alone and that in the end there is no meaning but what we find for ourselves. The 4 great existential worries. So these problems are unable to be solved. But to make the problems not unbearable or being overwhelming, what you need to do... So wicked problems can't be solved. They have to be accepted. And you act anyway. And this is the challenge. This is pretty much the challenge of growing up. Growing up is the acceptance of unwanted reality and choosing to act anyway. Not waiting for others to fix it, not waiting for others to mend it, not waiting for the world to change in some way, not waiting for your friends to change, not waiting for anything else. My role in this, my responsibility. I accept and I act on it anyway. And this is obviously not a rapid process. This goes on for years. But how do you make it such that these wicked problems don't keep overwhelming you? So this is the second aspect of what a child and adolescent psychiatrist would do is that you would work out how to make your life bigger. Because if your life is bigger, the problems are bearable. Nietzsche's classic comment, "He who has a why to live can bear almost any how." If you have a why, if you have a life of meaning, if you have things in your life that give you purpose, then you can bear with some pretty wicked problems. If you have a life, then dying is not unbearable because you've lived. All men must die, but first we live. All relationships come to an end, but first we love. If your life has meaning and purpose, then you can bear with being blind, or not having a leg, or not being the smartest, or having burns on your face. But if you have no meaning and no purpose, even the smallest suffering can feel unbearable. So the other aspect of a psychiatrist is to work with a patient and with their family on meaning and purpose. And the big three that give most people meaning and purpose in their life is who they belong to, their relationships, family, friend, lover, groups. They would be the big four. So working with patients and their families on how to have good relationships. In fact, some would argue the only purpose of therapy is to have good relationships. I wouldn't go that far, but it is certainly a very important part of a life worth living. The second thing that gives life meaning is what you do. And children and adolescents are right in the middle of that. Study, work, sport, creative. What do you contribute to? Helping others. For many people, a large part of their meaning of life is what they work as. And the third thing that tends to give life meaning is what you have a passion for. There's a movement in America, and it's something about finding your spark. So for children and adolescents, finding your spark, if you have a reason, if you have something that sparks you, something that interests you, then you can bear with problems if they're unsolvable. So this is what a psychiatrist does. You make a good assessment of both the problems and the person's life. And of course, you always work on solving the problems in physical ways, in ways with the mind, and changing the world the person lives in. Oh, I didn't put in school, obviously, is a very important change as well. Working with teachers, working with welfare coordinators. And if you can solve the problem, no problem, move on. But for those problems that are wicked, that are unchangeable, that have to be accepted, then the work is helping, bringing the child and the parents to a position of confronting these wicked problems, working with them around accepting it and acting anyway despite the problems. And that may involve looking at what is it that gives our family meaning and purpose? What gives me meaning and purpose? Family work. A large part is often doing both. You're trying to work out, as a family, what do we value? What do we want as a family? Not what we don't want. What do we want? And in fact, I've often had more success working at this level, trying to find the fun, trying to find the play. How do we love each other more than going through the 100 complaints and trying to one by one change them? So I hope this has given you a good idea about what a child and an adolescent psychiatrist does.